rheumatologists and physiotherapists use a hell of a lot to check how healthy a joint is. It basically is just a composite view of the health of the joint. Physiotherapists will laugh at us, but they have about 6, I think, different categories of end feel. We have 2, and you just need to know 2. The way to do it is all you ask is ask your patient, open as wide as you can go, okay? Then you take index finger on the lower incisors, thumb on the upper, and you jack the jaw apart, okay? That feel you get at the end, you all see it? That feel you get at the end when you're jacking it further apart is called end feel. There are only 2 types of end feel for our purposes. One is it's elastic, and the other is it's stiff. Okay? End of test 1. Second one is called joint play. Joint play gives you an idea of what the articular surface of this joint is like. So open please. Thumb on the molar teeth here. Grab the bottom border of the jaw. Just relax, let your jaw hang absolutely loose. With the other hand, you palpate the joint, which is about there, and you're going to move the joint through its border movement, like so. Preferably downwards and inwards. And you can do it again. You're going to do it on yourselves anyway. Okay? And all you want to feel here is whether this movement is smooth or whether it's rough. And if it's rough, it will bump. You'll actually feel a little bump as you move it along.
Is it hard to move that?
Sometimes it's hard to move. You've got to persuade your patient to relax.
Yeah. It's hard to relax.
It is very hard to relax. There are various ways of getting them to relax. There's a point over here. Just open slightly. Here between the coronoid process and the condyle, it's one of the acupuncture points, and if you play around with it, sometimes they'll relax automatically. But to get them to relax is the big secret. So, joint play, you again only have 2 descriptors. It's either rough or smooth. Okay? And then the third of these, and how long have all these taken? If we forget the yak part of it, but so far we're under a minute easily. Okay. The third one is called dynamic pain testing, and all we do is we cradle the jaw. We don't actually do anything to it. We just sort of guide it along. Open as wide as you can go, please. Close. Move your jaw side to side. Other side. And, okay, just with your jaw, push my hand forward. Okay. Open, close, left, right, forward, and all you want to know from your patient, does it hurt? That's it. Done. The fourth one of these is static pain. By static pain, I mean we try and immobilize the joint. In other words, we try and keep this jaw clamped, and we ask the patient to repeat the things we've done. So, try and open, please. And you try and stop him. It's basically you're trying to get an isometric contraction of whatever muscles open or close the jaw or move it sideways. So that's one. Open wide, please. Closing test, you stick 2 hands there and you ask your patient to bite slowly, and you say, and what I usually say, I say ow when I've had enough. So bite please, keep going, keep going, keep going, keep going, and then again, okay, thank you, and you say, does it hurt? And then try and move left, right, okay, and try and push my hand forward, but each time I'm trying to immobilize the joint. So, joints not moving, muscles are working, does it hurt? Those are they. Done. Now, you've got to sort of dissect this out. There are, as I said, 2 groups of patients in this group. One is what we call an arthrogenous TMD. Arthrogenous being joint related. The problem is in the joint. The other one is a myogenous TMD. The problem is in the muscles. These tests allow you to differentiate between those 2. The myogenous patient will have a elastic end feel, it's nice and springy, will have a smooth, generally joint play, will have a dynamic pain test, in other words unrestrained, which doesn't hurt, but a static pain test which does, because we've immobilized the joint, but we're getting the muscles to work and the problems in the muscles. So you can diagnose that group. The other group will have an end feel that's stiff, joint play, which is rough, it will jump around as if you're going over a corrugated iron roof. The dynamic plane will be painful because the joint's moving. The static plane will be less painful because the joint's not moving and the muscles are not affected. So we get two groups of patients out of this, and it takes precisely 1 minute to do, so you can hook it onto any exam that you do, and you're not going to lose out on time or on finance, because unfortunately finance becomes an issue as you get further up in this profession. Okay? But over and above that, it allows you to make a diagnosis. Now, when you write down in your TMJ exam, you know, that little note, nothing abnormal discovered, that's not a diagnosis, that's just describing a symptom. These two categories are diagnoses. They're gross diagnoses. Within each one, if you want to dissect it out further, there'll be 5 or 6 marginous conditions, there are about 11 heterogeneous conditions. For your purposes in general practice, doesn't matter. Marginous or heterogeneous, they allow you to triage these patients. In general practice, if you have homogeneous patients, you can probably deal with them yourself. They're amenable to easy treatments, usually simple one treatment modality will work, and they don't take up a lot of your time. With the supervisor, if you have patients who have chronic pain, then you can work out whether they've got chronic pain because the pain has been around for 6 months, they've been to numerous different people, you're just one in a long list of, you know, we've seen the doctor, the dentist, the shoemaker, whatever, there's just a long list. I can't work, my family are suffering, I can't relax, etc. You can work these, those you want to get rid of as well, because they're very difficult to treat. But the average marginous patient is something you can deal with in-house. The heterogeneous patient, much more difficult, lots of different types of treatments. You're going to see them again and again and again. You get no reward for them under the NHS at all. They're best referred to someone who deals with these problems, you know, or to an institution. So not only does this allow you to make a diagnosis, it actually allows you to triage these patients, to manage, decide how you're going to do it. And you can do it very simply with those 4 tests. Now those 4 tests test specifically for TMD patients. If you want to examine muscles, there are a couple of ones that you need to do. You would want to examine the anterior temporal, you would want to examine the masseter, you would want to try and examine the medial pterygoid, which you can get somewhere under here. You would want to look at the sternocleidomastoid, and you probably would want to look at the lateral pterygoid muscle as well. We'll start with the anterior temporal. That's a hell of an easy to actually examine. You ask your patient to clench hard, and you just palpate here over the anterior temporal part with a reasonable amount of force. If you want to know how much force, enough so that your nail bed turns white. That's about, I think, 5 kilograms or 4 kilograms per square centimeter, something like that. But when your nail bed turns white, you know you applied enough pressure, you don't want more. So that's the anterior temporal. To do the sternocleidomastoid, you ask your patient to push you. Hold a hand against the cheek here and ask him to push it. Now, you push my hand towards that wall with your head. Try not to turn it. Just, yeah. And you can actually see the muscle come up here. Okay? There it is, with a little split over there. And you can actually palpate it quite easily. Okay? And the other way, get him to turn the other way. And there it is, nicely accentuated. And give it a good press again. Till your nail beds turn white, and you ask, does it hurt? Very simple.
They're usually looking for pain from the patient.
With muscles, basically all we are is looking for pain. You can be very sophisticated if you've got myofascial pain and look for tight bands. Myofascial pain is a very specific pain, and dentists tend to use it sort of indiscriminately. But it's very specific. It's got a ropey band with one point, which is called a trigger point. If you press on it, it produces pain, but pain at another side, usually at least 2.5-4 centimeters from the point where you know, the trigger point. And that's true myofascial pain. But in general, we're looking just for pain. Okay, so those are the what we've done, sternocleidomastoid.